My name is Jonathan Fellows, and I'd like to take a few minutes to tell you about the integrated care system we're building in the Black Country. In particular, I want to talk about what an integrated care system is, what it will do, and why we need one. The Black Country has a population of nearly 1.3 million people, and it covers the 4 boroughs of Dudley, Sandwell, Walsall and Wolverhampton. It was one of the birthplaces of the Industrial Revolution, with coal mining, iron foundries, glass manufacturing, brickworks and steel mills, all creating high levels of pollution. The first time this area was called the Black Country appears to have been almost 200 years ago, in the 1840s. It might have got the name because of the soot and the smoke from all those industries, or perhaps it was because of all the coal seams close to the surface. What is clear though, is that although the heavy industries have now largely gone, their legacy lives on in terms of the impact on the health and the well-being of the Black Country population. Sadly, many people in the Black Country don't live as long as those in other parts of England. A lot also don't enjoy good health and face other challenges. There is a great deal of poverty and deprivation in the Black Country. Just under half of all the people in the Black Country live in some of the most deprived areas of England. There are also more people in the Black Country who don't have jobs, don't have qualifications compared to the rest of England, and children don't do as well in school as in other parts of the country. Healthy behaviours and lifestyles are also important when looking at people's health, as these lead to more people living with long-term conditions and ill health. The reason we need to alter how we're providing health and care to our population is so that we can work alongside our communities to start to change some of those outcomes. It won't be easy, but that mustn't stop us from doing everything possible to make a difference. The population of the Black Country is very diverse. Overall, around 30% are from Black, Asian or minority ethnic communities, although in Sandwell that's as high as 40%, and in Wolverhampton it's 39%. Communities include people from Bangladesh, China, Gambia, India, Italy, Jamaica, Nigeria, Pakistan, Philippines, Poland, Somalia, Zimbabwe and Yemen. We need to make sure our health and care services are easily accessible and available to all of them. The environment in which we're born, grow up, live, work and age in, as well as the decisions we make for ourselves and for our families, have a bigger impact on our health than healthcare alone. We know that differences in health outcomes and life expectancy, as well as opportunities for good education and job prospects, don't affect everyone equally. So a one-size-fits-all approach won't work. We need to work with each of our communities to help identify the specific problems to tackle, and we'll also need their help to come up with the best solutions. The COVID-19 pandemic has shown us how health and care services can work together better. All services played their part, with GPs, councils, voluntary and community groups working together in local neighbourhoods to reduce isolation, tackle loneliness and support those most vulnerable, while hospitals work together to share resources, look after a lot of people suffering from COVID-19 and also ensure that people who are ill could still get the treatment they needed. But even with all of the great examples of our health and care systems working together and breaking down barriers, we know that for some of our communities, COVID-19 has led to inequalities increasing, not reducing. If we were to carry on as we are, we'll need more hospitals, more care homes, and a lot more health and care workers. Not only is this unaffordable, it also wouldn't be the right thing to do, as it wouldn't help people to live longer, nor help them to live in better health. We need to change. One of the most important things to realise is that health cannot be improved and health inequalities will not be reduced by the NHS acting alone. Although improving the quality and accessibility of health and care will play a part, there are many other factors such as income, education, employment, training, housing, the environment and crime that all have an impact. Only by working together to deal with all of these factors will we start to be able to make a difference. So our integrated care system is a partnership across health and care providers, local authorities, voluntary and community organisations, the police, fire services, housing, education, colleges, universities and large employers, aimed at coordinating services better, improving the health and the lives of Black Country citizens, and starting to tackle and reduce the inequalities that exist between the different communities across the Black Country. By working together with partners from our integrated care system, we want to improve outcomes when people need hospital care and treatment, improve the health of our Black Country population, remove the inequalities that we currently have in access to health and care, provide care that focuses on the person receiving it and makes the best use of their time, connect health and care services in a more joined up way so that we can make better use of the money we have, and play our part in improving education, training, employment and housing to give our communities better prospects. I said earlier, none of this will be easy, but I also said that mustn't stop us. By 2030, with more people living into old age, some of the things that will help us to know that we've succeeded will be if people are living longer and healthier lives, people are staying healthy in their own homes and communities, people are taking greater responsibility for their own health. When people need hospital care, they get the best care at the right time, and prospects for education, employment and housing are much better. However, there are also two other groups that it will be vital to have deeply involved if we're going to succeed. The first group are the communities we serve, who need to tell us the things that need to change and help us to find the right answers. And the second is all of the people that work in health and care. They have a vital role to play, as they will know what changes will make the most difference. They will know how to do things better, and we need to involve them. Most of the time, our people and our communities know what the solutions are, so we want to listen to them, work with them and support them so that together we can make the right things happen. This will be a new way of working, putting people and communities at the centre of the whole system. I hope you will all want to play a part to help make a difference and to deliver a healthier future for everybody in the Black Country. Thank you.